And then after that role, you shifted to a research associate position at Virginia Commonwealth University. Tell us about that shift and what do you do in that role?
Yeah, so that role was the one that I mentioned before about being able to do some of the marketing work and doing the obesity prevention stuff. So, that was it was a good project. It was a really good project, just engaging, young adults into better choices and around like their weight and around their physical activity. And it was really about identifying whether incentives worked or not to getting people more engaged in their physical activity and in their overall healthcare. So it was really cool. And again, I learned a lot. I learned a lot from the people who were involved in that project.
And you're also a program coordinator at Virginia Department of Health.
Yeah, so I would say that is where I really cut my teeth in a traditional public health setting. I was a pretty young man, but I was like, jumping right into this whole public health world, straight to the state health department, and I guess for lack of better words, I became the man, right? Or I became a state bureaucrat who is known to be part of the problem. And, with that being said, recognizing all that I was up against, it was very important for me to be able to fight against those things and realize that it was it was critical for me to be in the space that I was in to be able to make changes or to at least show up in a way that folks had never really seen public health or state health department professionals like show up before, particularly when it comes to working with subcontractors, meaning like our community-based organizations that we were funding to be able to do work in the communities. And so all the work that I was doing was based off of HIV prevention work. So this was during a time where things like pre-exposure prophylaxis and PrEP was coming into view, and we wanted to ensure that we were building up on that engagement and making sure that it was getting to the people who needed it the most. But and even in Virginia, we were based on this project, we were able to offer it for free. But the model of if you build it, they will come doesn't always work. So this is one of those things where we were able to give it free, but we're like, well, why are young Black men who are having sex with other men, why are they not getting on PrEP? And it's because people at the health department weren't listening to where their needs really were. I kind of already touched on the importance of social determinants of health, and particularly for Black gay men or even like people of trans experience, there are a lot of priorities that supersede that who they're having sex with, right? And the conversation about who they're having sex with. I mean, the elephant in the room is, everybody's having sex, and we know that. But the reality of the matter is that really what's most important? So if someone walks into your door and looking for services, and your only thing you can offer them is an HIV test, is that going to be enough? Or if the only thing you can offer them is a pill that's going to keep them from getting HIV, that's fine. But what about if I don't even have, let alone a roof over my head, I don't even have a nightstand to put my pills on? So why would it even matter if, I have access to this thing? So it was really important to do that work. And, again, from two different spaces of one, realizing the needs of the community and hoping to change the system and ensure that processes were made in such a way where folks could get those their needs met, but also working with the community-based organizations and helping them to build their capacity to better serve people and to better serve the communities that were most indicated for PrEP and other prevention services.
Yeah, and I think you're hitting on the point of just how important it is for people to have their basic needs met. And we can't assume that everyone has all the things. And I think the biggest example is when people talk about like food classes where they're like teaching people about nutrition education, and they say, no, you can use your oven to do this. And people are like, I don't even have an oven. I don't have a microwave. So it's like, how can you even, they're not even on that same page. Just like, how do you get them those things that they need to actually do the things that they need to have a healthy life? And I think that's one of the things we always have to keep in sight when we're doing public health work. So appreciate that perspective and you being able to do that work as well.
Absolutely. Yeah, it's meaningful work, and it's so important. And again, and it looks different when you're reflective of the communities. It's the communities that you're trying to serve the most. And I will always highlight that in any type of like advocacy that I'm doing. That it is important for representation. Right, representation is always critical. And I think with this particular project, what was interesting was that this was sort of a homecoming for me, because though I was based at the state health department, the services that were being provided was directly to the city and the communities that I was born and raised in. So it was so much so to the point where, you could have someone from the health department go down to try to work with people and they will be resistant to it. But even down to like, oh, well, we're going to pull that person out and we're going to send you in. So I can go to these communities and out the gate, folks are like, oh, you look familiar, or I know you, or where did you grow up at? Oh, that's right here in our backyard. and that changes the perspective a little bit, right? It changes what's going on, and it becomes a certain level of built rapport and built trust that actually aids in, what we're trying to accomplish here. And it definitely helps when you actually mean well. And so for me, it was sort of a homecoming, and it was very personal work because I was able to, again, go back to my home and support the people who I even grew up with and who we came of age together, and, just be able to make that meaningful change in an area that, that helped to build, and make me to be who I was. So it was good stuff.
Yeah, and you've been highlighting throughout the conversation just how important it is to build that trust, because many times the conversations that you're having are not easy conversations, and it has like maybe quote unquote confidential information or just information that's hard for people to talk about. So building trust is one of the first things that's most important in doing a lot of this work. And shifting now to your current role, you're the Director of Health Department Initiatives at the Southern AIDS Coalition. How do you come across this, and what do you do in this role?
So, I guess just for clarity's sake. So, interestingly, I've actually not even been in that role for the past almost 2 years now, actually. So I've moved on from that role. And however, that role was a role that was also so critical in my journey, though, because it was my transition from, the health department space and into more of a community and a regional advocacy space. So it was really about scaling up. So, I went from a place of being able to advocate for the needs of people of my state and the people of the communities around my state to now being able to advocate for the needs of people across the entire South. And so that was really important because because the South is known for, particularly in the HIV world, known for carrying the brunt of new HIV infections and high incidence rates. And so it was good to be able to shift in that space to really understand the landscape a little bit better and to understand what the needs are. And I guess one of the interesting things about this as well is that I transitioned into that role right in the beginning of like COVID, right? So it was a learning that was happening as far as learning how to do this work differently. So much work, particularly in HIV, is about going to the places and being in these spaces and, getting out to the people. But what do you do, and how do you pivot, and how do you support people in the pivot when you can't go to meet them where they are? The number one tenet of public health is meet people where they are, right? But what happens when you literally can't do it? And so I was so grateful to be in that role at a time where we were experiencing this new renaissance of how we even go about doing public health and how we go about doing engagement and how we work with people, and realizing how that has even shifted to today and how advocacy is different and what our needs are. One of the needs and one of the things that I've been able to advocate for while I was in that role was even access to like technology assistance, right? And not realizing that, there was a shift to things like, telemedicine, right? We can go to telemedicine. All you have to do is pull out your phone and, you can talk to your doctor. But what about the people who, one, don't have a phone? What about the people who don't have broadband internet? What about the people who live in a rural community in Mississippi that don't even have broadband access at all? Mm-hmm. So now you're talking about grandma has to go to the doctor, but she needs to be able to do telemedicine. And the kids are at home. They need to be able to do online learning. No one has internet, So you're creating there's new problems being created. So now we're trying to already work through this one aspect of the epidemic, but now there are new issues that are being brought up. So I'm saying this to say that, working in that role during that time was difficult, challenging, but rewarding because it was really about shifting what my own understanding of, what this work even is and what it looks like. And I think that's really shifted and propelled sort of where like my trajectory kind of leads to now, in a way where I'm unrelenting in thinking about what the needs of people are, because we're now in a space where you can't tell people what they need. You have to listen to what people are saying that they need. And that's going to be our ticket to being able to work on getting folks' needs met to be able to address health outcomes.
Absolutely. I love that the shift to you're saying in like doing the work, and then are you scaling it up? Now you're thinking about how can we approach this work at a greater level, which is also something that we always think about when we're doing public health initiatives. It's like, how do we get to the populations that really need the services or support or whatever the needs might be at that point in time?
Yeah.